Hi, Miss Simmons. How are you today?
Pretty good, thank you. How are you doing?
I'm doing fine. So, my name is Darcy, and I'm from Speech and Swallowing Therapy. Your doctor asked me to come and see how things are working in your mouth and your throat. I did have a chance to review your medical record, and I would like to start by asking you a few questions about your eating and your drinking. Okay.
Mm-hmm.
All right. First off, have you ever been evaluated for swallowing before?
No.
All right. So, pretty simple process. I'm going to go over a few questions with you. We'll take a look in your mouth and then we'll do a few tasks together.
Mm-hmm.
And finally, I'll have you take some food and liquid to see how you're swallowing. Could you tell me about a typical meal time for you? What issues are you noticing?
I usually try to take small bites and chew thoroughly, but when I swallow, it feels like sometimes it gets hot.
Okay.
And I take several sips of liquids to try to help it to get down.
Okay, that's good. Do you ever find yourself coughing when you're eating or drinking?
Yes, I sure do, especially recently.
Okay. I did also notice in your chart that you take a few medications. Do you find yourself having difficulty with swallowing those pills?
The non-enteric coated pills they tend to feel like they get stuck.
Okay. They feel like they get stuck.
Mm-hmm.
Okay. All right. Well, I'm gonna ask you a few general questions.
Okay.
Real simple. When were you born?
July 10, 1961,
All right. What state are we in?
Indiana.
And what year is it?
2026.
All right. And can you please tell me why you're here today?
Because I'm getting concerned about the food feeling it's getting stuck.
Okay, for your swallowing your chews.
Mm-hmm.
All right.
Mm-hmm.
Okay, I'd like to take a look inside your mouth, see how things are looking.
Mm-hmm.
I did just wash my hands before we started, so
Okay.
got our clean hands. Can you go ahead and open up your mouth for me? Can you tilt your head back a little? Okay. All right. Next, we're just gonna go over a few tasks together. The first cranial nerve that we're going to be assessing today is the facial cranial nerve 7. It is a mixed nerve, which means it is both sensory and motor. It innervates the muscles of the face, including the lips. Impairment in this nerve could result in anterior spillage out of the oral cavity due to a poor labial seal. Mm-hmm. All right. Can I have you raise both eyebrows for me? All right. Next, can you fill your cheeks up with air? And I'm going to apply a little pressure. Try not to let the air escape. All right. It is kind of silly. All right. Can you say ooh and then e?
Ooh, e, ooh, e.
All right. Okie dokie. Thank you.
Hello, Miss Daniel. First, we are going to check cranial nerve 5. This is the trigeminal nerve. This innervates the masseter, temporalis, medial and lateral pterygoid, as well as the mylohyoid. This is a mixed cranial nerve. If this cranial nerve is impaired, you would see reduced mastication abilities of solids. Close your jaw and keep it closed while I try to open it. Now open your jaw and keep it open while I try to close it. Open your mouth and move your jaw from side to side. Okay. Now we are going to check cranial nerve 10, the vagus nerve. This innervates the pharyngeal constrictors, soft palate muscles, the intrinsic laryngeal muscles, the cricothyroid, and upper esophagus. This is a mixed cranial nerve. If this cranial nerve is impaired, you would see impairment to the vagus nerve, which may result in a weak cough, indicating that limited ability to protect the airway in an event of penetration or aspiration. Okay, Try to get a good cough from me, Miss Daniel. Now clear your throat. Say E. Now we are going to check cranial nerve 12. This is the hypoglossal nerve. This is also a motor nerve. This nerve innervates the intrinsic tongue muscles, the genioglossus, hyloglossus, and the styloglossus. Impairment to the hypoglossal nerve could result in poor bolus formation. I'm going to press really hard against the side of your tongue as you press press back against the tongue depressor. Now we are going to check cranial nerve 10, the pharyngeal plexus. This is a mixed cranial nerve. The pharyngeal plexus innervates the superior, middle, and inferior pharyngeal constrictors, the palatine muscles, uvula, and the striated portion of the esophagus. If this is impaired, you would see weakened pharyngeal constriction. Stick your tongue out, straight out, and now move it from corner to corner, up to your nose and to your chin. Good. Now I'm going to shine a light in your mouth. Say ah.
Ah.
Now say ah, ah, ah.
Ah, ah, ah.
Okay, now I would like to check the feeling around your mouth. First, please close your eyes. Great. Now I'm going to give you a couple of directions. I will let you know when you can open your eyes. Oh, we are checking the somatosensory nerves. First, we are going to check her face and her cheeks. These are both cranial nerve 5. Let me know when you feel a light touch.
Okay. 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 Okay.
Now, please open your mouth. Let me know when you feel a light touch.
Uh-huh. Uh-huh. Uh-huh.
Now we are going to check her tongue and the fossil pillars. These are both cranial nerve 10. Keep your mouth open. Let me know when you feel a light touch.
Uh-huh. 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 Uh-huh.
Now, keep your mouth open and let me know when you feel another light touch.
Okay. Uh-huh.
Okay, thanks. You can open your eyes now. Now we are going to check her speech AMR. Now I'm going to say different sounds. I want you to say pa 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 as fast and as evenly as you can while still being clear like this. Pa 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 pa. Keep going until I say stop.
Pa, 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 pa.
Stop. Now say ta 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 ta.
Ta, 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 ta.
Stop. Now say ka 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 ka.
Ka, 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 ka.
Stop.
Ka.
Mr. Johnson, how are you today?
Good.
Good. Today we're going to be doing your clinical swallowing assessment. We're going to be checking some thin liquids, purees, soft bite size, and some regular foods. All right. Is it all right if I touch your throat and your mouth today?
That's fine.
I'm just going to have you swallow for me. So just swallow. And go. Good. And open your mouth. So we are going to start with a thin liquid. And we have some water. And we're going to start off with half a teaspoon. Open your mouth. Swallow. Okay, how did that feel?
Fine.
Good. Can you open your mouth and let me see? Tongue in. Good. Okay, now we're going to do a full teaspoon of water. Okay. And swallow. Let me see. Good. Okay. Now you are going to take a sip from the cup. And swallow. Let me see. Something. Alright. Now we are going to drink out of a straw. Just one sip. Okay, and swallow. Good. And see in your mouth. And tongue in. And now we are going to take some sips out of the straw consecutively. 1, 2, 3, 4. In your mouth. And tongue in. Good. Okay. Now we are going to try some purees. And for the purees today, I have some applesauce. So we're going to start with a half a teaspoon of applesauce. Swallow. Good. And I'm going to get my tender presser. Light. Tongue in. Okay. Good. And we're going to do a full teaspoon. See it in your mouth. Tongue in. Good. Okay. And now we're going to our soft bite-size pieces, and we have a banana for that. So I'm just going to start off with a small little bit of banana. Chew and swallow that. Okay. No pocketing of any food. How did that feel?
Good.
Good. And now we're going to start off with a larger bite. You can chew and swallow this one. Swallow that. All right. Nice. And the last thing we're going to do is our regular food, and we're going to use a cookie. So we're going to do a small bite-sized, and then we're going to do a regular piece. Okay. Okay. Sherry, swallow that for me. Swallow when you're ready. Good. How does that feel?
Yeah.
Okay. See? And in. Okay. We're going to do regular size. This one's a little bit larger, so it may take a little bit longer to chew. Swallow whenever you're ready. How did that feel?
Good.
Check. Okay. All right, Mr. Johnson, everything looked good. Would you like any water to sip on? Or are you good?
I'm good.
Okay, everything looked good. Thank you so much for coming in today, and we will get those results to you shortly.
Thank you.
Have a good day.